It is breastfeeding month, and we know it's really a hot topic and questions people have throughout the year. So we're here with Carey Acosta, one of our lactation consultants, as well as Nancy Martinez, and she is our mother-baby nurse educator, and we're so happy to have you both here with us today. They're gonna answer questions, kind of debunk some myths, and really get into some of the benefits. And quick shout out to you both, because you both were award winners of nursing awards at Homestead Hospital. So we're lucky to have you and take a break from your busy schedules to join us today to help us answer some questions.
Thank you.
So before we kind of dive into some of the topics, just remember that you guys, if you have questions, comment in the Facebook section or wherever you're watching. We'll answer as many questions as we can at the end or throughout the segment. Feel free to keep asking questions, and we'll answer. Even after the segment's over, we may come back and answer your questions. So feel free to dive in. So Carey, let's start with you. Just talk about general breastfeeding tips. Give us like a little overview of breastfeeding, why it's important for many, and what are some things that people should kind of think about, maybe if there's a mom who's pregnant or their spouse is kind of preparing for a baby to come into this world. What are things that they can think of?
Something they can think about is maybe getting a breast pump, calling their insurance company. That's really important. I have a handheld Amita breast pump here. Making sure that everybody understands what you want to do as far as breastfeeding, that your family's on board, stuff like that. Getting, a boppy pillow, sometimes that helps, or just a regular pillow. Those are things you can also get. And then maybe just, taking a breastfeeding class or something else might be beneficial.
Great things to kind of get your mind ready. What are some of the benefits? What I've heard is there's benefits both for mom and baby. So let's talk about maybe mom first. What are some benefits to breastfeeding?
So for mom, some of the short-term benefits, it helps her belly go back to the pre-pregnancy size. It helps that uterus to get small. It lowers her risk of breast cancer, long-term diabetes, heart disease, osteoporosis, ovarian uterine cancer. So those are really long-term, important benefits. And then also it helps her to stop bleeding, as much when she's breastfeeding, because the uterus does contract, which is nice. You're not going to bleed as long after you have a baby. So.
And then for baby?
Oh, for baby, a ton of benefits. Decreases the baby's risk of SIDS, of heart disease, diabetes, leukemia. They're healthier. They get sick less often, less allergies. They do better in standardized tests. So it's really, beneficial to both mom and baby.
And I know I myself have 2 young babies at home. It was a little bit challenging at first for me. I had a baby in the NICU. He was preemie. So I want to kind of turn it over to you, Nancy, because you have your own personal story. You have 3 children.
Yes.
Talk to us a little bit about your journey and kind of how you can sometimes mentally prepare for some of the challenges and overcome those when trying to breastfeed.
Definitely. So I just want to start with, you prepare your pregnancy and you've got your support team and you're planning to breastfeed and you have everything in place. But when you go to give birth, there are other things that can happen. Hopefully everyone can have a vaginal delivery and we can do the skin to skin and do natural breastfeeding as we can. But there are some times for the safety of the mom and the baby, they have to do a C-section, which I experienced 3 different C-sections with my children in the past. But that's one of the common things that moms think, that if they have a C-section, they won't get that same experience. And yes, you definitely can breastfeed with a C-section. So we're going to talk a little bit later about different ways that that will help that breastfeeding with the C-section. The other thing is having the preterm delivery, or a sick baby that is going to be taken away to a neonatal intensive care unit that you might not get to breastfeed right at that time. But we just want to make sure that you understand that, keep that in the back of your mind. If that was your plan, there's still ways that you can breastfeed.
Maybe other
We're going to talk about
maybe
pumping,
like a pump,
storing the milk, that when the baby does able to breastfeed. I ended up with my first child, an emergency C-section, and I was in a lot of pain. I was having a lot of emesis after the delivery, and I wasn't able to breastfeed. So they kept giving him a bottle, and I just kind of felt defeated. I tried for a couple weeks, and I didn't really have the support that I needed with family. And everyone sees you tired, they see that you've been through a lot, and they just want to help. But the best thing that they could do is try to help you with the support of the breastfeeding. but I ended up giving a bottle. So, and that was okay. He did fine. My second son too, I made the choice to give formula, which was okay. But with my daughter, I decided I'm going to really go all out. I'm going to get all the support I can. I went to a Baptist Health support group through the whole time, and I ended up breastfeeding her for 9 months. So it was a successful time that I was able to compare 2 different ways that I did. So we just want to let moms, no matter what kind of delivery that you have, you're able to still breastfeed, successfully. So.
And I think it's an important point you make. While breastfeeding is very important and there's lots of benefits, as you mentioned, sometimes people have that mom guilt, like, oh, I wasn't able to do it. I tried and I couldn't. So I think it's a good message to say, it's not the end of the world.
Your babies are still going to grow and they're going to do well. And all 3 of mine have done very well, so very proud. We can talk a little bit about those 3 different ways. So
let's get into that.
Let's
get into maybe
the different
some
positions.
different positions.
All
We
right.
have a baby here today to model for us.
Especially with the C-section, I think that's really where, like Nancy was saying, she had 3 C-sections. I had a C-section. So for me to put that baby on your stomach,
belly
which, you have
hurts.
cradle, which is the traditional, breastfeeding position that everybody is more familiar with, but then that baby's on your stomach and it can become really painful. So a lot of times football hold is really well. It works better in that position because you're able to kind of control the baby, prop it up on maybe 2 pillows, and just like that. And for people that don't have a boppy, you don't really need to have one. You can get one. But honestly, I use
Boppy's that
the
like
boppy's
circular pillow.
right, the cute little breastfeeding pillow. I just used 2 regular pillows, had no issues, propped up my son and breastfed. And it got to the point where I got so comfortable, literally doing football hold. I would be holding my son like this, cooking on the back burner, and my husband's like, "Oh dear Lord, what are you doing?" And I'm like, "The baby has to eat. I need to eat. What are you?" So. I think it's more just getting comfortable with the different positions. Yeah.
And you mentioned earlier when we were chatting that they really, especially in the beginning, they don't need that much. So these are kind of some samples here of like belly sizes of babies, right? So talk to us about that.
So this is actually a baby stomach size the first day of life. It's about 5 to 7 mLs. And if you look at this bottle here, most formula bottles when you get them it's about up to about 3 ounces. And a lot of times moms will give 3 ounces of milk on the first day of life, but the baby's stomach is 5 to 7 mLs. By day 3, the stomach goes to about 26 mLs. So that's when maybe they might do like an ounce.
Day 10 is about
Day 10 is about 60 mLs. So you can see the difference in size of the stomach. Clearly when we bottle feed, a lot of times we are overfeeding those babies. And a lot of times I'll go in a room and a mom says, "I don't have enough milk. I don't have milk."
Question.
And I will show them this little ball and I ask them, "Are you really going to feel 5 to 7 mLs of milk in your breast?" No, because that colostrum is so thick. So a lot of times just seeing this makes them feel a lot better, realizing they don't need such a large volume so early on.
I think it's such an impactful visual to see it because I come from a Latin family and it's like, oh my God, they're no tienen suficiente leche, they need like milk. And then when you actually see, wait, they really don't need that much. They're babies, they're little. This is helpful because when you see the bottle, you think, oh my God, I don't have enough. So thank you for that. That's helpful. Any other kind of tips or tricks or things that people should know about trying to get that milk supply in? I know we talked about some of the myths.
About how often. So, we're concerned when we formula feed, so that's what we compare to, is that, yes, we tell them to feed every 3 to 4 hours. And so I think that we go into sometimes some moms and some families believe that with breastfeeding, it should be every 2 hours or every 2 to 3 hours. And what they will quickly find out is that baby actually wants to feed every hour. And so what we know is that in the very first 24 hours, what we want you to understand is that you can feed on demand. Whenever the baby is showing signs of hunger or is rooting or wants to suck, put them on the breast. What's going to happen with all these frequent feedings is that you're going to establish your milk supply. And that's what's going to help that milk come in day 2, day 3, the more we have them on the breast. So that's where I think you get frustrated mommies. They feel like they don't have enough and they're, oh, I just fed him, and he's crying again. Nope, put him right back on. And that's that first 24 hours. Do you see that? I think
I think a lot of times I'll go in the rooms and, when I'm seeing a mom, and it's true, the baby will be cluster feeding, which is when that baby feeds, it'll feed, 10 minutes later it feeds again, 20 minutes later it feeds again, and that mom at that moment and that dad are both like, oh my God, mom has no milk, and that's when they want to give a bottle. but it's normal. Going back to the baby size, day 1 it's this, by day 3 it's this. So day 2, that's when that baby typically does that cluster feeding, and that's when a lot of times that's when they end up giving a bottle. And I tell moms, the baby's going to be at the all-you-can-eat buffet probably for 5 or 6 hours. Once you get past that, you're good. But it's getting through that cluster feeding. And then, you know, at about 2 weeks is when you finally start getting your groove. You start to feel a little bit better. And then by a month, you're just second nature. It gets a lot easier. So.
And I just one thing to add is that breastfeeding is a huge commitment. And I found that too. I thought, wow. I'm not getting any rest, and I was tired, and so when the baby sleeps, I'm like, okay, he's asleep, I'm gonna go take a shower, I'm gonna go cook dinner, I'm gonna go to this, and that's not. I didn't learn that, unfortunately, till my 3rd child, that nope, when that baby's sleeping, you're like, you go take a nap, because that's when you really are gonna get those cat naps with the baby. You have no idea what the night is about to entail. You could be up all night feeding, but it's a large commitment, and you are gonna get tired, and that's where we bring in that family support. They can come in and they can change the diapers. They can help make the meals. Little things that are going to make a big difference.
Even preparing, like you even have an example here
the milk storage
milk storage bag. Even if it's putting the date or you know, having these laid out and prepared, washing some of the equipment. Little things that are
cooking
helpful,
dinner, doing the laundry,
allows
anything.
you to rest. So let's talk a little bit about the mental part of this. So I think, you know, what advice do you give moms before, during, and after? I think, you know, sometimes they're overwhelmed, or they're exhausted, or they have anxiety, they want to quit. So what do you tell?
Before a lot of times I tell them, just be ready for whatever comes. Be open, you know, because you don't know. You've been 9 months, especially with a first-time mom. 9 months, you have never had to breastfeed before. The baby's never breastfed. It's going to be a learning curve for both of them. You know, once the baby comes, I tell them, it is going to be tiring. Just try and stay positive. And again, that sleep, it's so crucial. You know, and a lot of times I'll have moms that have given it their all, and maybe it doesn't work out for them. And I tell them, don't feel defeated, because breastfeeding is not going to be the only thing that's going to define you as a mom. There are so many things that will define you, that child will look back on and remember and say, I had such a great mom. They're not going to remember where they were, you know, whether they were breastfed or not. Yes, it's a wonderful thing, but don't, you know, I don't want women to ever feel defeated if they can't, because that's so important, I think.
So let's get into some of the myths. We printed a few. You know, you're Googling, you're on the internet, you're like trying to prepare, and you keep hearing all these things, and even chatting before. You know, does having a beer help your milk supply, or you know, what should I eat? What should I drink? What should I do? How, you know, all those things. You know, maybe somebody told you, you know, my mom couldn't breastfeed, so I can't either. So let's debunk some of these myths and kind of go through some of them. So let's start with that one about hereditary thing, your grandmother, your mom. So that's
has nothing
doesn't
to do
come
with
into
it.
play.
Nope.
Okay.
And a lot of times, you know, oh, my mom didn't, my grandma didn't, and I'm like, okay, but you're not them. Every baby's different, every pregnancy's different. So really that shouldn't really play a role into it.
That goes along with the other, how the family feels about it too. And one of the reasons is that maybe the mom says, oh, I didn't breastfeed and the babies were fine. But so you really have to do, you know, if you're choosing to breastfeed your baby, you know, you have to tell grandma and mom that, yes, this is my choice and this is how I'm going to go forward, and I want your support with it as well. Another myth that I had brought up was that going with the breast size that I can't breastfeed because of my mom was how about a small size breast or large size breast. You know, I'm not going to, there's no way I have very small breasts and I can't make enough milk. And we know that is not true. So breast size doesn't matter. So your breasts are able, I was talking with Carey at work, and there's very few women, it was how many percent?
Like 1% of the population won't be able
can't
to
make milk.
Won't be
so
able
as
to
long as
breastfeed.
that you're putting that demand and you're having that baby breastfeed, you're going to be able to make milk.
Okay. What about the eating, drinking? Can I have a glass of wine?
So
can I not?
You can have a glass of wine, but it does not mean like supersized glass. You know,
moderation.
Right, like a 4-ounce glass. And typically they say as long as you feel sober, you can continue breastfeeding. If you're going to have more than that, then we would recommend waiting until you know that alcohol's out of your system, and then you would resume breastfeeding. They also sell little milk strips where you can actually test your breast milk to see if there's alcohol in it, which is, you know, if somebody wants to drink, they don't have to stop, living their social lives.
I have a group of friends that, you know, you kind of have that one night out, you know, you've
Mm-hmm.
been not sleeping, you go out with your friends, and then there's this myth about like pump and dump. Like we had 2 glasses of wine, now we had. So talk to me a little bit about that. So you said in moderation.
Right, and the whole thing about pumping and dumping, it's you're not going to get the alcohol out of your system any quicker by pumping and dumping it out. It's really just you need to pump so that you don't get engorged, because if you don't pump, you're going to
feeding the baby,
right.
your milk will
That
back
can
up.
right. It can affect your milk supply, and you can get engorged. But really, just
Moderation.
Moderation, exactly.
Okay,
exactly.
good.
And coffee too.
Coffee, and I think people
You
say
can have
dairy
coffee.
products or veggies or
You
certain
can
things,
eat-
but you can eat anything.
You can eat whatever you want, and I really always when I talk to moms, I say, look at women that come from other countries. Look at their diets. Women in Mexico, they eat very spicy foods. In different countries, they have different varieties of food, and a lot of them, they don't have the option or the luxury of saying, oh well, I'm going to breastfeed and I can only eat this, and those babies do fine. If you notice that the baby's getting a little more fussy, maybe just back off of whatever that is, but eat what you want.
Okay, that's
Another
good.
big
Yeah.
myth was that if I get sick, if I end up with the flu, or if I
Oh,
get
yeah.
a cold
Right.
and I'm coughing, that I'm going to have to stop because my fear is I'm going to pass it to the baby. But you do clean, good hand washing.
Right.
You take care of. You don't want to cough on the baby, but you can still breastfeed. And there's a
Normal
lot
hygiene.
of normal hygiene, but stopping breastfeeding is not recommended, even if you're sick. And you can take medications. So there's very few or limited that you can't breastfeed with.
Yeah, there's
I think
very
when you're
few.
pregnant, you're told like you can't take certain
Exactly.
things, but
Things,
after
right.
the baby,
Right.
just check with your doctor always. But
There's always check with the doctor, but for the most part, most medications are
okay.
safe. Yeah, most antibiotics, And going back to if you're sick and breastfeeding, really everything that you've been exposed to, which it's good. So if you have the flu, whatever your body's fighting off, you're going to pass those antibodies
over.
to the baby.
Right.
So that baby's going to be less likely to get sick anyway, which is
good.
Great.
which is
It's
good.
one of the benefits.
Yeah.
What are some ways that women can kind of help their milk supply come in? I hear a lot about go in the shower, take a warm bath. Does that help? What are some things that...
So really the most important thing to bring your milk supply in is supply and demand. There's really nothing else, no secret, anything like that. It's the more you breastfeed, the more milk you're going to make. If you're separated from your baby, like in the NICU, you need to pump at least 8 times in 24 hours to keep that milk supply established. There's things called galactagogues, which are basically like the cookies, fenugreek and stuff like that, all those little things that people can take. And, some people say they work, but really it's the stimulating of the breast. The more you breastfeed, the more milk you're going to make for your baby. Is really the most important
most
thing.
beneficial part.
If you get engorged or you feel, your breasts are getting hard, you can take a shower,
That's what
massage
helps
them,
with-
and soften them
When you
up.
hear about the hot showers, is
Yeah.
when they're getting engorged and you
Exactly.
feel, and you can do a soft massage type of thing in the shower.
And maybe
That
it's little
helps.
things that make you feel better.
Exactly.
That make you want to keep trying or keep doing
Exactly.
it. And maybe
Exactly.
not necessarily the milk supply coming in, but if it helps your sanity and you're like,
Yeah.
you know what, now this is making me feel a little better, then
Listen, just
I'll try
having the 10 minutes to go take a hot shower with the
Yeah,
newborn
exactly.
is a good thing.
Change
Like,
your
that's-
shirt. That's good.
Yeah, you're lucky.
Yes.
It's
I
great.
had one of my first experiences was a son that was colicky and vomited, had reflux quite a bit. So we changed a lot of different outfits during that time, but we kept on. So you just it's a different experience for your
Yeah.
babies.
So we're starting to get a few questions coming
Yeah.
in.
Okay.
So as they come in, we'll kind of answer as many as we can. And as they kind of continue to type and come in, I want to talk about support groups. I know you mentioned that you went to a Baptist Health support group. We have many, many support groups at Baptist Health. A lot of information is on our website at baptisthealth.net/events. But if you can touch a little bit about what those support groups provide, how you can kind of sign up or find them or
Yeah.
have them help you.
So I know La Leche League is great.
Okay.
They've been around for forever, forever and ever. Baptist Health does have a support group. Like you said, you can sign up online. WIC offers one. We have one at our hospital as well.
Okay.
And, just being able to go and be with other women that are breastfeeding. And, you might have somebody there with a 1-year-old or somebody with a 1-week-old. But it's good just to have other people that are going through the same challenges and, the same things that you're going through so that you have each other to kind of, you know, relate to. So it's
That
nice
was
in that sense.
huge
Yeah.
for me.
Yeah.
With comparing my first son to my third child. You know, the family's around, you have friends and family coming to see the baby in the first week, the first two, but then dad goes back to work, and then now
Right.
you're home alone every day, day in and out with this baby. It can be very trying. And if you don't have other friends and family with small kids, you feel all alone. And so that's what the support group does. Someone else is going through there. Oh, you're having issues, or oh, how's it going for you? Oh, now my baby's starting to eat. How do I do, you know, feeding the baby and breastfeeding? I'm
Right.
going back to work. Who else? So
Oh,
that
yeah.
was what I got that support group from, to bounce those questions off. There's many moms that don't, you know, are not attending or don't have a way to go, and they're left alone. So there is something we just have to, you know, we wanted to make sure that moms are aware that postpartum depression is a real thing, and it does affect a lot of moms out there. So if you ever feel, I know Carey's talked to several moms that have experienced that, and we want to make sure that they're reaching out to get the help they need as well.
Absolutely.
Yeah, even if it's just bringing a hot meal to your friend that just had a
Yes.
baby, you know, food can help,
Something,
and
yeah,
one less thing to
absolutely.
do in the house is have a cooked meal there. So here are some questions. Are babies hungry as they're born? So somebody's asking if they come out of the womb and they're hungry and they want right
Yeah.
away. Yeah? Yeah?
Yes.
Okay, yeah.
What
They wanna
usually
eat.
have- they have sugar stores when a baby's term. They build up some sugar, so they can break down and they can be okay. But babies have a naturally tendency to, you'll start seeing them suck,
Yeah.
and they have a natural rooting reflex, so
Yeah.
you'll start seeing them look very easily to either breastfeeding or to a bottle. So that instinct is built in, and they're ready to go. And so that's why we start off. But babies can, the first 3 hours, like they're doing
Yeah.
their vital signs and they're transitioning, they can be okay, but we want to try to get them breastfeeding as soon as we can, or if they have to bottle feed as
Right,
well.
right.
So
Absolutely.
I should also mention, as we kind of go through questions, that we have a Care on Demand app that actually is great. We just launched a service that provides lactation consultants and can answer your questions. And when I first heard about it, I'm like, oh, I wish I would have had this when I was
Exactly. That would
breastfeeding.
be nice.
You know, there's this hesitation of like, oh, I don't want to be in a video chat, you know, but if you have questions and you want to be in the comfort of your own home,
Absolutely.
just log into the Care on Demand app. We are offering a promo code right now, Nursing Mama. It's spelled MAMA for Mama, Nursing Mama. You plug in the promo code, you get a little bit of a discount. Ask your questions there. It really helps. It provides some sanity. Even if it's,
Absolutely.
you know, dad kind of logging in and asking, like, my wife has this, and this.
what's going on?
What are some things I can do to help? So just
Right.
know that everyone has that in their back pocket. Download the app. It's really helpful, and you'll get people like Carey and Nancy on there answering, you know, your questions, or other, you know, experts that can and really provide that support that you might need. So if we don't answer all your questions now, that's another outlet that you can use. So other questions: is it necessary to place the baby on the breast immediately after being born? You know, if you have some sort of complication, maybe you're not able to do
Right.
that.
So ideally, one of the recommendation is really putting that baby skin to skin immediately after birth. It doesn't mean that it has to be on the breast, but that skin to skin is so crucial for that breastfeeding. And we know that immediate skin to skin can actually increase long-term breastfeeding significantly. Now, if you have a baby that has to go straight to the NICU, it doesn't mean that you're going to be unsuccessful with breastfeeding, but definitely putting that baby skin to skin right away. And usually that baby will kind of crawl and make it to the breast within about an hour and breastfeed on its own. So yeah, that is really something that's
So if
important.
you're able to do it, it's great.
Mhm.
What happens if you skip a pumping session? I know a lot of people have apps and they time it and they have alarms going off, and
Yeah.
so is it okay? You know,
It's amazing once you get into pumping and the baby's breastfeeding, or you're going back to work. The breasts have a memory that it kind of knows
They know the
that
routine.
it knows the routine. I was
Yeah.
able to, as a nurse, I worked 12-hour shifts. I got through after a period of time where I didn't have to pump throughout the whole shift, and then
Wow.
right when I got done, I would either feed the baby or start pumping. Like, how did that happen? But if you skip a session, what'll still happen is that you might get a little bit more engorged
Right.
at that time, because if you're doing pumping like every 3 hours or however often that you're pumping, you might feel that engorgement happen a little bit more. but it's just you're just going
So
to
you're
make
gonna
up
get
for
into
it.
a rhythm, try
Right.
to stay in the
Yeah.
routine, but if there's
Exactly.
like an interruption in the schedule, you
Right.
might
If
be
it's
okay.
if it's a one-time thing, I wouldn't be so concerned. But if you're going more than like 4 or 5 hours, that's when I'd be more concerned. You know, if you're doing it more often, because then you're at a higher risk of getting mastitis
Right.
and getting
Engorged.
engorged. You know, which in the end can affect your milk supply.
Okay.
So,
So let's take one more question. We have a few minutes remaining. So I'm a working mom. Will I confuse the baby if I just breastfeed at night and pump the rest of the day? So you kind of answered this a little bit, kind of figuring out that routine. Everybody's
Right.
different.
You know, we want, and that's what we always say, try to establish a good milk supply. And even if you plan on going back to work, once the baby's sucking and you introduce the bottle, you know, so
Right.
they do have to learn sometimes the difference in breastfeeding and going to some type of bottles. There's so many different types of nipples on the market. You can try a few different. Some babies do fine.
Right.
Some babies do get a little bit of nipple confusion, but that usually happens when we offer it too early. So usually once a good milk supply, they usually have
Or
no
if you're
issue.
traveling and you're going somewhere, you know, and you have to start pumping and give that bottle, it's kind of good to prepare.
You know, that's the thing about breastfeeding. That's awesome when you travel. You don't have to bring
Right, you're ready to
anything.
go.
You're in the back of the car,
On
or
the
you're in
way.
the hotel, and that's it. You're breastfeeding. So that was the beautiful
Yeah.
thing about breastfeeding.
You
If
don't
the
have to
baby's
warm
coming with
anything
you.
up.
The baby's
Yeah.
if
Yeah.
the baby's coming with
If
you.
it's
Right.
not, then you have
If
the
you're not,
option
you're
to.
not gonna. Yeah, you
Then
wanna
that's
pump.
where this comes in.
Yeah.
Like the little portable pumps.
Yeah.
Okay, one more. What about if you have breast implants? I know people ask about that. Can I still breastfeed?
You absolutely can,
Okay.
depending on it doesn't even matter. Yes, you can breastfeed. Now, depending on the way it's done, sometimes it can decrease your milk supply a little bit, but for the most part, most women are completely successful with breastfeeding with implants.
Okay.
So you want
Absolutely.
to check if your hospital has a lactation consultant.
Yes,
Because in that
absolutely.
situation, that's where you'd want to try to have her come and meet you as soon as, you know, the baby's born. And, you know, so she can give you
Give you specialized
that
tips
specialized
Right.
and ask your questions.
to see if everything's
We're
going
so
well.
happy to have you here. We're so
Thank
thankful
you.
that you
Thank
answered
you.
lots of questions, kind of debunked some myths. So we hope you
Nice.
come back and visit us. We're so happy to be able to have this segment and educate viewers during Breastfeeding Month. Again, I mentioned earlier, we do have support groups. Feel free to visit baptisthealth.net/events for things in your area. We also have, as I mentioned, Care on Demand. It's a great platform and tool to have on your phone, very easily accessible from your house to ask your questions. Use that promo code NursingMama, MAMA, to get a little bit of a discount there. So again, thanks for joining us today. Thanks for answering lots of questions. Feel free to keep asking them, and we'll answer as many as we can afterwards. And again, we'll see you next time here at the Baptist Health Newsroom. Take care.
Thank you.